ISD regular board meeting. It is Tuesday, August 11, 2015. It's 7 o'clock p.m. Agenda item number 1. We call this meeting to order. We do have an established quorum. Item number 2, roll call. Please say aye if present. Oscar Medrano.
Aye.
Michael Vargas.
Aye.
Angel Mendez.
Present.
Arno Padilla.
Present.
Hector G. Leal.
Aye.
Joe G. Gonzalez. Dr. Filomena Leo, our interim.
Here.
Mr. Tony Torres, attorney. Okay. Item number 3, Pledge of Allegiance to the United States and Texas flag. And item number 4, invocation. And I'm going to turn it over to Mr. Vargas.
Thank you, Madam President. The individual leading us tonight in the Pledge of Allegiance to our Texas and U.S. flags, as well as our invocation, is Ms. Amber Lynn Estrada. She is from the Positive Redirection Center. Amber Lynn Estrada is an 8th grader, 15 years of age. Amber's favorite subject is science. Amber's hobbies are playing volleyball with friends and family. Amber's accomplishments are to finish school and attend college. Amber's parents are Lizette Gonzalez and Robert Estrada. So if we can help me welcome Ms. Estrada. So we'll first start with the pledges.
And before we get started with the opening ceremonies with the pledge and invocation, we would like to observe a moment of silence for Berta Cavazza Middle School principal, Albina Lopez. She had been employed with the district for a number of years, and she recently passed away. And they will have the funeral services at the San Benito Funeral Home. And if you could please join me in a moment of silence before we get started. Thank you, and we ask that you keep her family in your prayers, in your thoughts and prayers. And so now I'm going to pass it over to our student here that has been gracious enough to do both the pledge and invocation for us this evening.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to the Texas, one state, under God, one indivisible. God of our creations, we come before you to welcome you to this meeting. We give you respect and acknowledge you as our creator and provider. God, as we begin this meeting, we ask you to guide our thoughts and our actions so that we may start a successful meeting and a new school year. We ask that you would guide and direct our meeting so that it is full of wisdom, productivity, and respect for one another. We pray in your name. Amen.
Thank you, Amber. We'd also like to recognize Mr. Ray Saldana, who's in the crowd. Thank you, Mr. Saldana, for your leadership. And parents of Amber Estrada, if you are in the audience, can you please stand up? Thank you.
Agenda item number 5, superintendent's report. A, disbursements. B, disbursement by organization. C, investment report. And D, superintendent update. Dr. Leo?
Members of the board, you should have received in your packets the complete set of disbursements for the month. Are there any questions specifically from anyone? Superintendent's update was also sent to you by mail on Friday, and if it is acceptable with this board, I would like to continue the practice of sending you by mail a summary of primary weeks, the week's activities and upcoming activities as well. Thank you.
Thank you, Dr. Leo. Item number 6 is public comment, and we have 2 individuals that will be up for public comment. The undersigned wishes to address the San Benito CIC Board of Trustees, and by his or her signature shows upon the board that he or she understands the following provisions to addressing the board. The persons wishing to address the Board of Trustees shall register with the presiding officer or designee no later than 5 minutes before the announced time of the school board meeting, shall state their full name, shall state what organization or group, if any, is being represented, shall state the topic they wish to address before the Board of Trustees, shall refrain from commenting directly on any individual school district employee or public official by name, but may instead refer to a specific employment area, job title, or the Board of Trustees as a whole, and shall refrain from attacks on individuals. The speakers will be allowed only 5 minutes to give his or her presentation. And the first individual is Rosalinda Garcia.
Good evening. I start off by welcoming Dr. Leo to a district that is rich with numerous committed, dedicated educators and employees. Along with that, the district has a superb Board of Trustees. Every single one of you has my support, respect, and thankfulness. Each and every one of you, not 3, not 2, all 7. You are a board that will share ideas and discussions and work toward a vision of attaining high standards and making decisions in the best interests of the district. At the last regular board meeting, we had the pleasure of listening to a former board member, president, regarding her concern with possible micromanaging from present school board members. And she went on to say that interference from board members could have been the cause for Dr. Puig's sudden departure. To Dr. Puig's sudden departure, I remind the community that he gave a statement to the local paper that he was resigning due to personal reasons. He went on to say that he had a good relationship with the board and that had nothing to do whatsoever with him resigning. I ask you, the community, would a principal that was recently hired resign because the parents were placing too much pressure? Or would the principal resign because some teachers were being uncooperative? Of course not. Dr. Puig resigned for personal reasons and not because of school board interfering. On micromanaging, I say to her, it is a fact that just recently Dr. Puig had presented to the board the option of approving TRS as the insurance agent, I believe, for the district. Board members did not approve TRS and turned down the recommendation. I think they must have asked him to find another alternative after researching and asking questions themselves. Is that micromanaging? Most recently, there were reports of possible loss of jobs because of being overstaffed. Jobs that seemed to be cut between 200 to 300 as reported in the Valley paper. Now, the board could have possibly expressed some concern to the superintendent and maybe went, wait a minute, that is a lot of staff reduction at one time. Let's find another solution. Is that micromanaging? The former board member went on to say that the straw that broke the camel's back was the board's urgency in dropping the present insurance carrier and not researching. To me, the straw that broke the camel's back was when a healthy balance of 60 million dipped to 2 million, more or less, plus or minus. The straw that broke the camel's back was when a former board member suspended Mr. Limon in 2013 or 14 with pay and hired an interim superintendent and paid him the same salary as Mr. Limon. To me, the straw that broke the camel's back was when you could have given Celeste Sanchez, assistant superintendent then, the responsibility of running the district and not have to pay an interim superintendent. And to me, the straw that broke the camel's back was when the community learned that you did not allow Mr. Limon at graduation the joy as a parent to hand his daughter her diploma. Thank you.
Next individual is Kim Harper.
Good evening, school board members. Thank you for giving us the opportunity to express our concerns regarding the Mighty Lady Hound softball team. Let me start by saying that we work very hard to represent San Benito. We work all year and not just during softball season. We endure harsh environments, leaving our blood, sweat, and tears on the field. We gladly do this for the love of softball. We're asking the board to give a little back. We still don't have a head coach, and we would like the board to consider hiring our coach promptly. We need a head coach to help us in our journey to greatness. We need someone to be there for us and help us challenge our skills. We need a head coach to help schedule our preseason scrimmages and our tournaments. To our understanding, some preseason games have already been set up by a Harlingen team with the stronger Upper Valley teams. We want that. We do not want scrimmages against weak teams. We won't get anything from playing those games. To be the best, you must play the best. We have a softball class during the period of school which needs to be well coordinated in order to maximize its benefit. The board can't expect us to just plug in anyone and babysit us. We need someone with skills to help us grow and prosper. We have a good team capable of continuing the tradition. We have several freshmen coming up that will require the head coach recommendation to move up. We request the board to act promptly. Do what's right to help us. To our understanding, our AD has recommended an individual for this position. Please take time to review this recommendation, as we would like to have our head coach already. It takes time to bond and create a trusting relationship. If the board continues to delay the hiring of our head coach, this relationship between player and coach will not develop in time and will adversely affect our season. We are the team to be. We are the best team in the Valley. All we need is leadership to help us guide our vessel to the promised land. We sincerely appreciate your considerations and prompt action to our concerns. Thank you so very much. Sincerely, the Lady Hounds and their parents.
Item number 7, in order to promote efficient meetings, the board may act upon more than one item by a single vote through the use of consent agenda. Consent items placed on the agenda should be marked with an asterisk. Consent items or items for which no board discussion is anticipated and for which the superintendent recommends approval. Prior to the time which approval of the consent agenda is had, at the request of any board, any member of the Board of Trustees, any item on the consent agenda shall be removed and given individual consideration. Under Business and Finance, 1508A-1, discussion and presentation of Mexor PBM services.
Question.
1508A-2, request for approval of the purchase of admission, review, and dismissal ARD software system.
Question.
Question as well.
1508A-3, request for approval of 2015-2016 Equity Center membership. Consent. Request for item 1508A-4, request for approval of 2014-2015 budget transfers.
Question.
Under Administration, 1508A-5, request for approval of the revised San Benito CISD teacher appraisal calendar for the 2015-2016 school year. Consent. 1508A-6, request for approval of TTESS teacher appraisers. Consent. 1508A-7, request for approval of the Communities and Schools contract agreement for the 2015-2016 school year. Question? 1508A-8, request for approval of the Region 1 Library Services and Instructional Resources Cooperative Commitment for the 2015-2016 school year.
Question.
And item 1508A-9, request for approval of delegate and alternate for 2015 TASB Delegate Assembly.
Question.
Question. We approve the consent items. Okay. Do I have a motion to approve consent items?
Second.
Okay, all those in favor say aye.
Aye.
All those against, say nay. Motion passes. Let's go back to item 1508A-1, discussion and presentation of Maxor PBM services.
I just
we
wanted
have-
to get a clarification. Are they presenting today? Okay,
Yes.
excellent. Then I'll pose the questions as they...
Okay,
Thank you.
great.
Good evening. My name is Jennifer Wynn, and I'm actually your account manager for San Benito CISD at Maxer Plus. I actually implemented this plan, and I've been on board with this group since the startup last October. Tonight, what I'd like to do is present you with an overview of the plan, performance, and make some recommendations on ways for the district to save some money. If you want to move to page number 3. This is just a copy of your performance summary. And I'm not going to go through each item, but I did want to highlight a few of the data elements. We took the last 6 months' worth of data. The average number of members per month is 2,537. This includes employees and dependents. For this 6 months range, you had 21,397 claims. The utilization runs less than 1 script per person, which is right in line with the industry standards. On the next page, you'll see the pharmacy utilization broken out by number of prescriptions and amount paid by pharmacy. This includes your top utilizing pharmacies. The current plan design was mirrored from the previous coverage that we got back in October of last year. Everything was set up exactly the way it was before. There are 3 pharmacies in this area: Fry's, Medicine Shop, and Salinas Pharmacy. Members were driven to one of these 3 pharmacies by copay steerage. Due to the way the drug coverage was set up, you can see the majority of your drug spend is at one of these 3 pharmacies. Yes?
I have a question. You referred to steer. My recollection when we went through this, our direction to consult with assistant. Maybe that's why I didn't have it on. Let me start again.
Sure.
In looking at the amount of cost that has been pulled out of particular vendors that have been used, it is concerning because when this pharmacy plan was put together over a year ago, the board's direction was that we assure that we kept our local vendors as a part of the network, not the network.
Correct.
And as I see the amount of draw that has been, it seems or it looks as if we are only utilizing these 3 or 4 vendors. Is that the case?
It does appear that way. There are other pharmacies in the network, H-E-B, Walmart, those are available to you. But certain medications were driven towards these pharmacies, like diabetic medications and diabetic supplies. Only diabetic supplies could be attained at these pharmacies for $0 copay.
When you say driven, in what manner?
By $0 copay. They couldn't even fill at a Walmart pharmacy, just for diabetic supplies.
So are you saying that all of these were diabetics?
No.
Then why is the huge increase on participation on only these pharmacies?
This is how it started from, the data was actually analyzed from January to June of this year. And all of the utilization is driven at these pharmacies, not just by copay. I'm sure convenience is also a factor.
Okay, and I apologize.
I'm
Let me
sorry.
go back to ask one question, and I
Go
don't
ahead.
want to bombard you
I'm
by
sorry.
two different people asking the questions at the same time. Let me, and I'll finish up with this one. When you say that they were driven to these pharmacies because of the zero copay, was the zero copay created in effect only through these pharmacists?
It was something we copied from the plan design with the previous PBM.
Okay. That's very concerning because that's not what the board had directed when the last plan had been approved. Okay.
Okay.
Thank you very much.
Now reiterate what Mr. Padilla mentioned. The biggest concern that we have is when people are going to other pharmacists and being denied those services. And it is very difficult to stand up here, to sit up here and see that everything was channeled just to these pharmacies. I mean, how do you explain that?
Well, there is copay steerage, but I'm sure that there is the clinics, drove these people to the pharmacy. The fact that they're local drives these people to the pharmacy. And I'm not sure, I don't know, I don't have the previous carrier's data from 2013 to 14, but I imagine that it looks very similar.
So I guess the question is, were other pharmacists allowed to be partake in this plan?
Yes, we've never restricted the network.
Then how were they denied? How were some of the prescriptions denied in other pharmacies such as CVS, Walgreens?
Do you have a specific example of a
Sure,
prescription?
the one CVS in Brownsville or the CVS in Harlingen. They said that the services were not being rendered because of something that happened, something that had to do with the process here at our district. So my question is, who denies or approves these requests?
Everything that we set up in our system was set up to the prior coverage. That was what was given to us. Now, the only thing that I can think of that would have caused any kind of rejection at a CVS pharmacy would be a diabetic supply, test strips, meter. But if it was another drug, I'd be happy to talk with you individually.
Well, I mean, it's not just one individual. It's probably more than one. And from my background knowledge on the individuals, it wasn't a diabetic medication.
It wasn't a...
No. So just seeing that this is the list that we have, that it's only here in our town, definitely we want to maintain the funding here in San Benito, but we have employees that live in Brownsville, McAllen, Harlingen, other districts, so they have to come all the way to San Benito to purchase their prescription. I don't see how that, should even apply.
Well, and that actually is one of our suggestions, is that we're going to open up the network so that diabetic medications and supplies are not restricted to these three pharmacies. As far as the other drugs in question, I would have to look at them individually to see what they were and why they rejected, because they should not have.
Okay.
But there are a number of factors that will cause a drug to reject, so. But I would be happy to look at anything individually and just to make sure that setup was done correctly.
So for me, the question becomes, I wasn't on the board when it occurred, but for me, it seems that something was presented and directed by the board, and we got a product very differently thereafter. So my question is, individuals that were involved in the manipulation, so to speak, of what the board wanted and what the district ended up getting, because it affects not only the employees, it affects the businesses, and affects the perception of what the board's trying to do. So I'm assuming in your suggestions, you're going to provide remedies to not only identifying what the board wants and needs, but essentially actually doing it and making sure individuals in the district are following suit. And I think that was the problem before.
Yeah, absolutely, I agree. Whenever I did the implementation for the setup, I didn't personally speak with the board. I took it over from the current TPA and administered it that way.
So would you say the implementation and execution portion of the plan is what was lacking before? I'm trying to wrap my head around just how this would occur. I wasn't on the board, of course, but if you can give me something.
Since I mirrored their prior coverage, I'm not certain. That was the way that the plan document was provided to me, and I just mirrored it. So I'm not sure where the breakdown in communication occurred,
Okay.
because we simply mirrored the coverage.
And one last follow-up.
Sure.
and I know where you're, based on what your message is going to be to us, you're heading us towards a direction of assuring that it's open to everyone. And our intent here is to assure that our staff have the opportunity to seek the medication they need wherever they may be.
Absolutely.
And at the same token, protect the integrity of what the district does, together with supporting local vendors, because we also want to support our local vendors. And again, the message was just assure that our local vendors are in the network, not identified as the only. But I think to assure that this does not occur, and we're not sitting here a year from now, would it be possible to get quarterly reports to assure us how many vendors are being utilized, in what region, whether they're local, state, national, or even international, because we do have travelers that go out of state or out of country and may need medication. And I'd like to see that to assure that we're able to verify that the direction is being followed correctly, and assure that our staff are able to seek the medication they need. So
I'll be
simple.
happy to provide any kind of reports that you'd like on any kind of basis that you'd like.
Thank you.
You come to me personally, and I'll make sure that it's taken care of. Mhm. If there aren't any more questions with this slide, I'll move on to the next page. It's not a slide since you don't have the presentation up. This is a copy of the current copay design, and this is what was mirrored from the coverage that we obtained. You can see that it's broken up to 3 different plans. You have a high, low, and managed care. The copays are broken out by 34, 62, and 93-day supply. Your mail order copays are over here on the right for each one of the plans. And DAW 1 and 2 penalties were applied. That's if a physician writes for brand or the member requests brand. The bulk of your employees and dependents are in the managed care plan currently. Some unique aspects of these plans that I'd like to point out are what we've actually already discussed, the diabetic medications and insulins that are set to a $0 copay. This helps drive compliance for the diabetic members. The diabetic supplies could only be obtained for a $0 copay at one of the 3 local pharmacies. Nebulizers, which are durable medical equipment, are actually covered at a $0 copay. And of course, to be compliant with the Affordable Care Act, the preventative drugs have been implemented at a $0 copay. In addition to the $0 copay on the diabetic supplies, the managed care plan has a list of $0 copay drugs that we acquired. These medications can be obtained at one of those 3 local pharmacies for a 93-day supply for a $0 copay. You could get them at any other pharmacy, but if you wanted a $0 copay, you had to go to one of the 3 local pharmacies. It also was mirrored from the previous.
Let me ask the question again. 2 things. One, I understand that we're identifying specific product. Let me ask you, are these medications that we're identifying a part of the requirement of the Affordable Care Act?
These are not, no, sir.
Okay. Why would we be identifying specific medication product?
I have to be honest with you, no clue. I simply set it up to mirror we were told we could not change upon implementation in October of 2014.
I'm going to be very honest. I need a validation as to why we would be identifying a specific medication and only making that medication. And it's not to take away the use, because we're here to help and assure that we protect our staff. I just want to assure that we haven't identified a product that is only favorable to a staffing group that use it, whatever. We just need to be fair. I mean, if these are the highest use products, and I'm not in the medical field, so I wouldn't even know what each one of these are used for. But maybe it would be good for us to be able to identify what they are used for, and what population scope of our staffing use and utilize this. In the end, there may be a justification for this, and one that we may be satisfied with, but then it could be that we're not.
Right.
And in my recollection, none of this was identified to us as specific products that were identified for $0 copay. So as we move forward, I would like at least some information
Sure,
to
I'll
be able
happy
to grasp this.
Once everything has been implemented with the new structure, I'll be happy to send out a summary of drug coverage. It'll indicate any type of change, any type of copay, anything that's special with the plan design. And then I'll be happy to speak to each individual action as well. For example, these medications that you see here, Benicar, Bistolic, Advair, I ran utilization on each one of these, and it wasn't extremely high. These are common drugs. Most of them are for blood pressure, allergies, asthma. The utilization wasn't high, but it was something that I would recommend getting rid of, and as I can see now.
Well, if I'm in a CVS in McAllen, how much do I have to pay? Because you mentioned zero co-pays, they have to come to San Benito. So if I'm in CVS in McAllen, how much do I have to pay?
You would have to pay your brand copay, depending on which tier you're in. If you were in the high plan, the low plan, or the managed care plan, you would have to pay your applicable copay. You wouldn't be able to obtain it for a 93-day supply of zero copay. That was what was driven to those 3 pharmacies, the $0 copay.
My biggest concern is this. Why was this plan mirrored when we wanted a change?
I was never instructed that it wanted to change. I was instructed
Well, you said,
that it needed-
earlier you mentioned that you had a directive from whom? You stated earlier, you had a directive from whom, if it wasn't the board?
Assured Benefit Associate, the current TPA.
Okay. The other question that I have is going back to our original approval of Maxor. There was, Mr. Torres, there was in our reading, it showed that there would be a letter of acceptance that all medications were going to be favorable to all pharmacists. So my assumption on that is that the zero copay should apply to other pharmacists. Now, I don't know how that works or anything like that, but
Are you talking about the Saturday meeting?
when did we approve the insurance?
This is a Saturday meeting.
Was it a Saturday? Absolutely. Then,
The zero copay in the actual plan design wasn't voted on. It was at the actual carrier, which was Maxwell.
Okay.
And the board requested that the network be opened up, and that was taken care of. We've already communicated with Maxor. I provided a draft to Dr. Leo's office. She executed it. And actually, the representative that's sitting here in the audience, I can't pronounce his last name. Well, it was done, Mr. Bennett. The network's being opened up.
so,
As far as the plan design, the co-pays that they're discussing with regard to the previous years, that's going to be handled at this Saturday meeting.
okay. So so the direction that we're going is that the new design, if the pharmacist, the local pharmacist, whoever has a zero copay, it'll be the same copay across the board on all pharmacists, correct?
I'm actually trying to get rid of the $0 copay at retail.
But
Yes.
everything will be
Everything-
consistent?
yes.
Okay.
Yes,
Thank you.
absolutely. Absolutely.
If I may, I just wanted to clarify what, on page 6, what you are referring to, you're just doing a recap of what was in place.
This is all what's currently. in
Leading
place.
towards where we are going,
Yes.
what will be happening in the new
Recommendations, yes.
year.
Yes. That's fine, that's what we're here for. Okay.
And I think it's not necessarily clarification, it's more of a surprise that we're seeing the numbers and the values as they are when the board expected different. And I think that's our concern is we understand that, yes, you are redesigning, and you are redesigning to what you see and you understand what the board is looking for and seeking. I think is maybe 2 things. We're extremely dissatisfied that it was created in such a form that it came out, and one, we were not updated with the information. Had we been updated, maybe the appropriate changes could have been taking place in midstream or mid-year. So I appreciate the recap, because it definitely gave us an opportunity to see what was happening.
Absolutely.
We only ask that on some of the questions we have posed today, if you can get us further information, and obviously, if your recommendation is no zero copay, just the copay as it is, that's a decision or a recommendation you may make. But again, we appreciate the recap, because it does put things into perspective from what we thought we had, what we had asked for, and what we received.
Absolutely.
Thank you.
Absolutely. On page 7, it's going to just cover the plan design. This is clinical programs, prior authorizations, and quantity limits. Everything that's currently in place is fairly standard. We use our Maxor Plus standard prior authorizations, our Maxor Plus standard quantity limits. Those are what we use across the board for all of our clients. There are a few additional quantity limits in place that were, again, mirrored. Smoking deterrents are limited to 90 days per year. Blood pressure monitors, nebulizers are limited to 1 per year, but that's very standard. Test strips are limited to 200 per month, and all migraine agents are limited to 9 per month, and those are all very standard. Specialty medications, Maxor specialty exclusive and limited to 30-day supply. Most specialty medications should have been driven through Maxor Specialty Pharmacy. The discounts are deep there, and we can manage utilization of the drug at Maxor Specialty. I know that some medications have been overridden at the local pharmacies, so I would suggest that going forward, we not allow that. We move forward with just the restriction at Maxor Specialty.
Can you elaborate on that overwritten? What happens there?
That's typically, and some are a need. You might have an individual that goes to the hospital and has surgery, and they have to have Lovenox. Lovenox is an injectable form that causes the blood clots not to form after surgery. So it's something that you need to start. You can't wait for mail order. That might be something that would be overridden locally.
Oh.
And I would still suggest those type of drugs. A person cannot wait, for mail, but other medications were overridden for convenience or just at request. So,
And one more question. Where will the overriding occur?
usually at the time of the fill.
No, but by whom? Where and by whom?
I usually would get a call
You?
from the HR director, yes. And she'll coordinate with me.
Thank you.
So you have direct input on all overridden medication?
I can if they call me directly, yes, absolutely.
Okay.
If they go through our customer service department, most things are rejected at point of sale. If it's something outside of the box of what they know to do, then absolutely, they'll either come to me or they'll come to our clinical staff to find out what they need to do.
Is there any way to set up a more safeguard to that as opposed to somebody at customer service handling that with respect to specific medications?
Absolutely. Most specialty drugs, especially because we're talking about medications that are $3,000 to $30,000. Those are not overridden by our CSRs. They do get approval from either myself or from our clinical staff. Let's see.
Let me just address, these are drugs that are normally not at a local pharmacy, so no matter what, members are gonna have to wait 24 to 48 hours to get. No one keeps them on the shelves. HEB doesn't, CVS doesn't, the locals don't. So there is no disruption to your member. They have to get approval across the board throughout the U.S. for these kind of items because of cost. And the approval is through usually a clinical PharmD is looking at it saying, is it the right therapy for the right medication at the right time, best price? Can we get it to the member? And then we actually help the member in terms of copay assistance with the manufacturer and all that as well too. That's one of the big things we do. So that process, this is a huge avenue for you guys to focus on, because throughout the U.S., this one category is the largest category in drugs coming out we see today. This is the tsunami of cost in healthcare. The days of a $100 drug are kind of over. We now have a new cholesterol agent coming out that's going to be close to $15,000 a year, where cholesterol used to be managed under $2,000. So unless someone's hand-holding those drugs to make sure it's the best drug at the best price, at the best therapy, and not just getting it at retail, that's why we do it this way. But we're not disturbing any members in terms of access. Keep that in mind. They would have to wait 24 to 48 hours no matter what, no matter where they go.
It's never our goal to disturb the members. That are my number one priorities, to make sure that that person's taken care of when they need it, whatever time. So, and the good thing with our specialty pharmacy, it's a private label. We own it. It's our own pharmacy. It's right across the street from where I'm at. We have technicians that work with the individuals. They call them, they keep compliance, they work with the doctors, because it can be a very daunting process to be on a specialty drug. So they make sure they handhold the patient all the way.
What does the exit process look like for that once, I guess, we have closure for that specialty medication?
What I can do is I can run utilization on those members, and then I will personally have one of our specialty technicians reach out to them. And we can give them a termination date at the local pharmacy and say, by this date, it has to be moved to Maxor Specialty.
Is there any relevance relative to cost about the length of duration from those specialty medications? Or is it just a one-time deal? Or you can't really tell? Is that taken into consideration when making the decision?
Yes, especially if it's just a one-time drug, like my example for Lovenox.
Right.
It is not typically a drug that you take unless you're pregnant on a monthly basis. It's one time, you had surgery, you had a blood clot. We're trying to prevent another one from forming, so. And a lot of plans are okay with Lovenox. There's a few drugs that are okay, at one time at the local pharmacy, but never ongoing.
So there's just a reassurance that the unpredictability will be constrained through what you're, okay.
And if it's what you would prefer, I can put a restriction that absolutely no specialty medication get an override except for, and we can have a list.
Okay, and that's more of where I was going at, but of course then.
Absolutely. And that list will have to go through me. That's from the CSRs. They won't just get a call in from the pharmacy and put in an override. They will go through me or they will go through clinical.
Okay, and that was my original question, so thank you.
And the last item on the list is compounds. We're actually a little bit ahead of the game on compounds. We have those limited. They are FDA, any kind of FDA non-approved drug is excluded, and anything over $100 will require prior authorization. Compounds can be quite expensive, so we want to try to keep a tight lid on those. And moving to page number 8, this is where we're going to start with my recommendations and considerations. I'm going to suggest moving instead of from a 3-plan design to two designs. This will mirror the Blue Cross Blue Shield coverage on your medical side. We'll have a PPO plan that has copays based off generic, preferred, and non-preferred. Local pharmacy, CVS, Walgreens, Walmart, they will all be limited to a 30-day supply. No, if anything that's over a 30-day supply, 31 to 90, will need to go through mail order, where your discounts are much deeper. On the next plan is going to be the high deductible plan that will mimic the Blue Cross Blue Shield plan. We're going to go ahead and just keep copays on the pharmacy side. The pharmacy dollars will not accumulate towards the medical deductibles, so you will be able to pay a copay. The only thing that we will accumulate is a $500 deductible on brand name drugs. Generics will not accumulate a $500 deductible, but brands will.
Let me pause you there for a minute.
Sure.
Earlier you mentioned, and you're going with the high-profile pharmacies. You said CVS, H-E-B, Walgreens, and so forth. They'll be limited to a 30-day. Is that applicable to all pharmacists?
All pharmacies.
Thank you.
Let me rephrase that to any retail pharmacy.
Appreciate it. Thank you very much.
Absolutely.
So is that pretty common in the high deductible plan to even have co-pays for the pharmaceutical
I have seen
side?
it both ways. Where I'll see copay, depending on how high the deductible is, we don't want a person to go to the pharmacy and all of a sudden have to pay $800 for a drug. We'd rather see them, it's easier to pay that on the medical versus the pharmacy. They're taking a maintenance drug on a monthly basis. If we implemented the above copay structure, the approximate plan savings would be $15,000 annually. And there would also be an increase in rebates of $80,000 annually because we would steer them towards preferred brands. Kind of already talked about the 30-day supply at retail. The next item is moving to our select pharmacy network. Don't let that name fool you. It's not narrowed, it's not smaller. It's a broad pharmacy network that includes multiple pharmacies. I ran utilization off of the current network that you have now if we moved to the select network to see how many people would be affected, and nobody would be affected. So you would get deeper discounts on your drugs at the pharmacy and no member would be affected. On the diabetic supplies, I know that we discussed the $0 copay at the current retail pharmacies. I want to keep that $0 copay, but I want to do that at mail order. I think that allowing the $0 copay allows for compliance from the member and keeps them on their drug, but this way you can get the $0 copay and get the deep discount that's at mail order. If they go to a retail pharmacy, they can, and they'll pay the applicable copay. So you're going to realize savings at mail order because you get a deeper discount. If they decide to just go to the current local pharmacy, then they'll pay a copay. So now you'll be collecting a copay at the pharmacy.
What does the time frame or logistics look like for mail order?
Our typical turnaround time is 2 weeks, but we're here in Texas, we're up in Amarillo, so it is a little bit quicker, but we always say that we allow for 2 weeks.
Is this process simplified, or, I mean, in some cases, when you do a mail order, I mean, it can be very complex for an individual. Are y'all going to have any training on how to do their mail orders, or is there
Absolutely.
assistance, or?
Yes, we have a customer call center that's open. Actually, you can reach them Monday through Sunday, that they can call and answer their questions. I'll be happy to put together a member packet information that goes out to all the members, and I'll be happy to discuss it with them at their open enrollment meetings. But it is a pretty simple process. Just get a 90-day supply from your physician and send it into the mail order pharmacy. You can call in for your refill. We have an online refill ordering, and there's even a phone app that you can reorder your medications. The first time that you order is probably the most difficult because your address needs to be put on file, credit card, that sort of information. But once that's on file, it's just as simple as ordering a refill like you do locally.
And the reason we say 2 weeks is these are 90-day supplies. So you're at minus 14 days from 90, you get notified, do you need a refill? The reason we just don't mail it out, because we don't want to cause a claim for the district. The doctor might have changed the drug, we don't know. So we notify them, is this the current drug? Yes. Do you want your new 90? Yes. It's coming in the mail. So there's no lack of care. I mean, we're not talking someone who needs a 5-day zip pack. These are people who do this are maintenance drivers, 90 days every day.
I would like to ask that you follow up with the risk management coordinator for the district. I think that anything that you can put together in the way of printed brochures, flyers, this being a new way of getting medication for many people, I agree. Once you get someone started on the process of going through mail order, it will be easier for them to become accustomed to ordering that way. It's helping them through that, and if we just give them an 800 number to call, I don't think that's enough. So if you can work with our staff, please, at getting something ready for when we go into enrollments.
That is not a problem.
Thank you.
Not a problem. We have a packet that I can actually provide that has our customer service information. It has a mail order form, common questions, that kind of information, and I'll be happy to go over all that.
One more question, and this is in reference to method of payment. I know you mentioned credit cards. What if the individual doesn't have a credit card or any form of
We still do cash and check and money order.
debit? Okay, thank you.
Most of these drugs are zero copay. So in terms of cost to the member, there should be no disruption in terms of that. And there's a reason for that. We don't want someone to have heartache over getting a fill. That's why the district's off, that's why I recommend the district gives them zero. So there's no cash transaction.
Yeah, that actually, Dave leads into a good point on the $0 copay. If you'll notice that it's zero on generics at mail order, you have a very high generic utilization. It's running at about 87 to 88%. So that means that many percentage of your people are filling a generic, which is great. That's higher. The average industry standard is about 80%. So, okay. And on the last page, I would like to remove that $0 copay that we spoke about on that list of drugs. I don't think it's necessary, and you can collect a copay. And that will save you about $4,800 annually. So I know it wasn't a huge cost, but I don't see it's not necessary. My last suggestion would actually be to exclude a group of drugs called proton pump inhibitors, or PPIs. These medications are used for acid reflux and GERD. And the medications might include something like Nexium, Prilosec. I'm sure you've seen the commercials for them. They can now all be obtained over the counter. The only prescriptions that are still RX required is Nexium 40 milligram and Dexilant. Every other medication can be obtained over the counter. Since they can all be obtained over the counter, I suggest excluding this class of medications. The over-the-counter alternatives have been shown to be as effective as the prescription generics and brands in most cases. While 215 members might possibly be affected, the majority of these are already paying a copay for the drug, and so their new copay will just kind of take over the cost of the OTC equivalent. You have the potential to save $66,000 annually just by excluding this one class. And I will say that most of my current clients do not cover PPIs. So just to finish, if you do make the attached recommendations as we've discussed, you will be seeing approximate plan savings of 10% annually.
What is your name, ma'am?
Jennifer Nguyen.
Jennifer?
Yes, Jennifer. The last name is Nguyen.
Oh,
My
N-
husband's Vietnamese.
Nguyen.
Nguyen.
And what's your number?
806
806
324
324
5478.
5478.
And I'll be happy to give cards out with my contact
Yeah,
info.
yeah, thank you.
So before you go, I wanted to dovetail Dr. Leo's point as far as the enrollment process, and I know it seems like you already have a robust kind of way of educating the population on something so new, and that's kind of aligned with our general healthcare push to a very different system. As far as manpower, as far as literature, can you just paint a little better picture of how that's going to look? In terms of just manpower, I mean, you're talking about yourself, right? Who is involved with this, but other individuals who, in terms of the enrollment process and education process?
We partner with your enrollment process, so however you use it, if you're ancillary people, your Blue Cross people, we partner with them, we put a kit together, we talk to them, because in most cases you have enrollers come on and they sit by a computer, so we hand them the kits, we walk through them, we physically, both of us can be here to answer any of the questions. Your biggest questions are your specialty people, because as any teacher realizes, what happens to me? You made a change, am I left in the woods? You take someone who's being treated for cancer right now, what happens to me? Because right now, if they're hearing about this, that there's changes, there's panic in their heart. We know that. We have all the data of who they are, what they are, and what's going on. So we handhold those people, reach out to those.
So you do identify those individuals specifically?
Without a doubt.
Okay.
I mean, once we notify when you guys are going to open enrollment, we like to do it ahead of time because we don't want someone to have heartache.
Right.
We want them to go to work and know that they're going to be fine. And in most cases, there's not going to be any disruption in terms of cost out of their pocket, the way we designed it. So they
Okay.
should,
Just a shift.
it's nice to tell them, you're going to be fine
Right.
financially. What you paid last year, you should pay this year, and it's just a shift of how you get it. But we do handhold those people, and then we work with your enrollers, if not, come on and educate the group. And then we provide material for HR, and we can put it on your intranet as well. So there's many ways we reach out to the people, and I think we proprietary the card San Benito, if I'm not mistaken.
Yes,
So,
we currently
alright.
do the medical and the pharmacy card. Going forward, Blue Cross Blue Shield will do the medical card, and we will do the pharmacy card.
And so our material has your logo on it, so it does help when stuff goes to the home. They don't throw it away like we all do. You know, you get the mail, throw it in the trash can, walk in the house. Most people of your members open up San Benito envelope, and that's why we do it that way.
Okay. So yeah, my whole point is that we fight a lot of misinformation, so if you can help us be a little bit more proactive in educating our employees, that would be very, very duly noted and appreciated.
Absolutely.
What's your name, sir?
David,
David?
you ready for this?
Yes.
Works on mine.
Spelling test now.
Good.
Anton Giovanni, Antongiovanni. It's a good little Irish name.
Yeah.
During our employees' insurance enrollment, are you all going to be here to be able to provide this information to our employees?
Absolutely.
Okay, excellent. Thank you.
Okay. Thank you very much.
Any other questions?
Oh.
Any other questions?
You sure? Okay.
Is that it?
Thank you.
Item 15088A-2, question. Request for approval of the purchase of an admission, review, and dismissal ARD software system.
Yes, actually, what does this product do? How will it be utilized? Does anybody have any insight on this?
We have Ms. Cantu in the audience, our Director of Special Education, who can give you much greater specificity, but in essence, it is, please come up, it is a program that will help facilitate the massive tracking that is required by federal regulations when we are engaging staff in planning for students with disabilities. And Ms. Cantu can give you more details.
It is the actual ARD packet paperwork that the teachers fill out when they're conducting the ARD meetings, as well as administrators for any student with eligibility. The current one we have is going out of business, so we have been notified within the next 8 to 10 months, it will no longer be utilized. It was a very basic program, so a lot was still paper pencil. We still have quite a few of our documents being done by paper and pencil, so we do keep all the hard copies. And when we were notified they were going out of business, we were told we needed to start looking for a new program. But this is the actual ARD packet. I do have a sample of the one we're currently using, if you'd like to see. It has students at, if they're bilingual, what a state assessment, accommodations. So it is the entire IEP packet.
Actually, that was my question that I wanted to pose. Is it reducing the paperwork on your end? What is it doing for the user, the end user?
The user is the teacher at the campus. That there is a reduction in paperwork, there isn't with any of them, because every item in there is required by federal law. We do look at our Educational Service Center 18, the legal framework, and I'll be glad to provide you that. You can see on the legal framework, they give you a list of every single required area. Every area in any of the programs are required by federal law. The reason this one was chosen was we set up a group of presenters to come in and present to campus administrators, assistant principals, special ed teachers. So they, because they're the ones that actually utilize it, they were the ones that voted on which program they thought would best fit the needs of the students and help facilitate the process. What the special ed central office staff liked about it is when they do the full individual evaluations for initial assessments, you can upload it right into this system. With the previous one, we couldn't. We had to have hard copies along with computerized, so we were making parent copy, central office copy, principal, so a lot of copies, and then there was no way when students would transfer, all that information would have to be hand carried. With this one, well, the three we looked at, they all three have that capability, but this was the only one that actually had that FIE component in it, and that's what the administrators liked.
Go ahead. So in essence, and I'm trying to picture it because I know that there's a lot of process and procedural special ed, and so the user will be the teacher, administrator, yourself, and anybody else that has access to that file,
Well,
correct?
generally, the user is the teacher. They're the
Okay.
ones that prepare this actual packet. The administrator is basically the chairman of the committee, so they kind of oversee it. But generally, they don't do any inputting. The diagnosticians, speech-language pathologists, they will put in all their evaluation results, and that brings that whole packet together. Then a packet is an ARD meeting, IEP team meeting is set up with a parent, and everything is reviewed, and this one does allow for electronic signature. We will keep an original hard copy. This is web-based, so there will be a copy on the web, and the parent will receive a hard copy. It also allows us, it does allow for 50 different languages, but the only language that is free currently is Spanish, that we can translate the entire packet into Spanish. Currently, we cannot translate any of our evaluations. We have to hire somebody to do, because we use the Woodcock-Johnson, the Tony, the Wiscar, and those are all English. And the parts that come with the program in Spanish, but what we input, we have to hire a translator to translate those sections for eligibility.
So I'm very glad to hear that we're moving to a very efficient system, especially given, because I've sat on ARD meetings and ARD committees, and I know they're arguably some of the most important, and legally, it's the most important, right, for the school. My question is, in terms of the archive data, which is all on paper, how is that going to look transforming to the newer system? Is that something we're going to have to do?
We're going, yes.
Okay.
And that's a very good question, and that was the principal's first question was, are we going to be able to upload what we currently have into the system? And the answer is no, because our current system is a very, very basic, almost like a text where you just go in and type. It's
Right.
very basic. So we do have all the original art packets in our office. When a new meeting comes up, maybe through Child Find,
Right.
if it's a new annual meeting, they will have to go into the system and start from the beginning. The only thing this system does allow is it does connect with the Texas, so anything that's in the database right now, when students register, we can populate that basic contact information, demographics, address, phone number, things like that. But previous evaluations that were done, all of that is going to have to be inputted by.
So, and you have a protocol in place to, let's say, an art committee is being held, a protocol or some type of one-pager that's going to inform other stakeholders that we need, archive data, who's going to be the individual who's going to set that and who's going to be providing it to the meeting? Because you as a director, you can only do so much, right? So
What
are you going to
we will
delegate
do-
that responsibility?
And that has been one of the discussions that have come
Okay.
up. This year, we'll take the efforts of all of us. We will be personally from central office, whether it's a diagnostician, myself, SLP, speech language pathology assistant, whomever it may be, will be taking those original files, even if it's an annual. As you know, the assessment personnel is not required to attend an annual meeting. They're only required to attend if we're going to review assessment. At the onset, we will be present to ensure teachers have all of the information they need to get it started. There were two options. Option one was with this same program, but it was the lesser of the two, but it was a trainer of trainers. We did choose that option, not because it was cheaper, because we felt that since we were starting at ground zero, we needed to be trained thoroughly, so that if a teacher was having difficulty, we didn't have to wait to contact a company. We would be able to respond immediately and/or sit in those meetings with them and actually do the paperwork side by side till everyone became comfortable. So we will be the trainers for the district. The company will only come in to do the original one.
Who's the company, and how long have they been?
It's eStar,
eStar?
and I know it's used quite a bit by a lot of our
eStar.
surrounding districts, but the
How long have they been around, do you know?
I'm sorry?
How long have they been around? You don't know?
At least 20, 30 years at a minimum. Because they've been in the business before they were eSped. Then they
Yeah.
went to eStar. So the name has kind of changed. Now that they're doing, we don't have anything for 504. We are currently, if a district, a surrounding district were to ask for 504 paperwork, we only have hard copies. Where with this program, we can send it electronically now. They can send it to us, but we have to print it because our program doesn't allow for that.
How much did the program cost?
This program is $31,000. The one we previously had was $12,000. However, it was just a basic, like a PDF file, where you could only fill in certain text boxes. This one will allow, it is correlated with the state, so every TEK for every enrolled grade level is accessible for the campuses to be able to review. The other problem we had, well, it's going out of business, so it doesn't matter, but we had with NetIEP was they weren't in Texas. So we had to notify them of any changes within the state because they were just a basic. So we had to email and say, we need you to change when they did away with tax, when they went to STAR, when they dropped STAR modified, we were having to tell them, okay, go into this and change this, where this company is directly affiliated and keeps up with Texas requirements.
Just have one more question.
Go ahead.
I'm looking at it from the teacher's perspective, so I'm assuming they have an iPad or a keyboard or something of that nature that could pull out this IEP almost instantly, correct?
Every teacher in the district has a computer, and it is web-based, they can access it from anywhere.
Okay.
If they're here at a meeting and they have, a few moments and they want to work on the IEP, they can log in and access it from there. We, as administrators, Dr. Leo or anyone were to say, I attended a meeting, and how prepared was this teacher? We can log in and see exactly when they started to work on the document, how long they were logged in, how long they spent on certain areas, where they accessed it, We have been able to see the meetings today at 3 o'clock, and you didn't log in till noon. How are you truly planning a child's program for a year, an annual plan, when you logged in 2 hours before the meeting? So we can see all that. The other thing on this one that the administrators really liked was if you forget to address a section, it does send up a flag saying, go back, you forgot section, and it doesn't let you go on till you've completed all of it. Because we had very minor areas with, was there a translator present at the meeting? Yes or no? And teachers would skip over it, and that is something that has to be addressed. So this one will take care of that.
Just one last question, and I'm assuming that there was a rollout or a training for all teachers. Have they gone through this training, or is it still a process?
We had 3 presentations where they just saw the presentation of the actual program. We hadn't had an opportunity. I started working on it in March, but because with the changes, and I was asked to wait, and so we were hoping this summer we would get it, but it kept getting pushed back. And so when I spoke to NetIEP, which is our current program, they asked, how much longer, when are you going to let us know? Because we will let you use the system during the year, but we will turn it off in June, which would mean we would have nothing. So I came several times and was asked, well, wait till next month. And then when Dr. Leo came on board, I met with her again and brought my notes from all the previous meetings, and we were able to get it on the agenda. And what we wanted to do, and that's why I was sharing with you, yes, it would be quick, like 60 days, where we would turn it around. We're going to ask NetIEP to let us stay on board for 60 more days before we stop. But that is why we have made a commitment, and I've spoken with everyone in our department, and they are committed to go to the campuses, and if we have to sit in ours, we'll do it.
Okay.
And we'll make sure it gets done, and we're going to make sure teachers know how to use it and know how to use it well, because that is a compliance area. So they will not fail.
So if we approve this tonight, and how long for this software to become available?
If it's approved tonight,
Yeah.
I will contact them tomorrow.
Okay.
We already have a tentative trainer of trainer date for the first week in September.
Because school is around the corner, and you just mentioned 60 days. That's a long time.
We
But
would allow the teachers to
Okay.
continue with NetIEP for
Okay.
60 days. And within those 60 days, we're going to be training them.
Okay.
The good thing about this program, it is very user-friendly. And
Yeah.
a lot of this program is drop-down boxes where they're given options. A lot of it is where the tabs are available, and I know there's some administrators in the audience, and they can share because I asked that they be present. They're the ones using it so that they make the selection. And they really like the way, in response to intervention, RTI, student is struggling, we're considering a referral to special ed, you can directly upload it all right into this system. Right now, we're still paper pencil. We don't have any of that. We did go with Region 1, and we bought an RTI, some forms. It was 10,000 something that we paid Region 1. We will no longer have to purchase that because this has the RTI. We don't have anything for 504, but this has the 504. So 504, special ed, RTI will all be a part of this. And right now, we
Ms. Cantu, so based on that last statement, we should see a $10,000 savings from what you were buying on what you were paying for the RTI before, and what you, since this one carries it, you don't have to spend $10,000. Yeah, you have to spend the $10,000. And the reason I asked that is because I did see that this has an annual recurring fee of $21,101. So besides the $31,000 for the purchase, there's an annual fee of $21,000 annually?
Yes, sir. All of the programs, and we looked at IEP Plus, we looked at eSped, we looked at SpedBank, we looked at quite a few. All of the programs have a reoccurring fee. The only way, and we shopped around, but the only way really to get away is to go back to the old paper pencil, but all
So,
of
so this initial year, we're spending 52,000,
we are only spending the 31.
31?
Yes.
Okay, so it says, well, again, what I'm looking at, it was presented to us, says although there's an annual recurring cost of 21,100. Is that
Well, the
for
first year would be the
31, and then the
31,000.
following years is 21,000?
Yes, sir.
Okay.
And so in response to the initial question, will this save on paperwork? Yes, in the long run it will, and it will not reduce the amount of work that staff has to do in completing the process, but it will facilitate greatly the massive time that has been spent in meeting these guidelines and in providing for these children. And with that in mind, and the fact that it also offers those additional components, the 504, addressing that, and the RTI being able to manage that program as well, with those items in mind, administration would like to recommend approval of the purchase of the eStar software program.
Thank you.
Thank you.
Question item 15088-4, request for approval of 2014-2015 budget transfer.
Yes, I only had a question, and maybe it could be answered by Dr. Leo. When funds are being,
We need a motion on the last.
oh,
Do we need to, we can? Okay.
the question that I pose is on the request of approval on budget transfers. What is your process on notifying the principals, directors, or other administrators that are affected by these transfers?
Usually what happens, the transfer is sent to us, and it's processed through our department. It comes to us first, we check to see that there's funds, and then depending on the amount of the transfer, if it's changing from one function to another, we might need more signatures, and then it's done. If it's not done timely, they usually start checking to find out where the process is, where it's at, and why it hasn't been posted.
But let me clarify my question. When funds are being transferred, say, for example, from central office, and they pull out from instruction or other different programs, or the high school allotments or school district allotments, are the principals at the tail end notified? And if so, what is the procedure, and what occurs during that event?
Okay, so you're suggesting that if we're pulling money from one department, giving it to another department or campus, that's not the normal procedure. That does not.
Does it ever occur?
Very rarely, and if it does, it's usually towards the very end of the year when we've cut off spending for, various departments and campuses.
Okay. So my question is there notification to the director or administrator at the ones that are being affected by that budget transfer?
Most likely, there would be, not necessarily, because sometimes the money might be in salaries where they don't have access to that. And if we know that, say, for instance, they didn't fill some positions during the year, but we needed some money for something, we would not notify them of that, no.
So, assuming that we're close to the closing of the fiscal year, and they don't receive any notification, I'm assuming there's summer school going on, and if there's funds being pulled out without them notification, how will those effects, how would they have a response for their effects at that end to their staff or administrators or anybody that's in their
Like I said, that's not
oversight?
a normal procedure. When summer school is going on, the summer school expenses are paid through special accounts that have been set up for that, either under Title I or Comp Ed. So it would not affect summer school because those are covered by other sources of funds.
Well, the reason that I ask is, my biggest concern is that, assuming that there is funding being pulled left and right, as an administrator, I would have liked to get notified, of what's happening to my funding, if anything, and if I don't have any control on it, that's fine. But at least I'll have an idea of where the funding is going, so that's where I'm posing my question. So, are you all establishing a protocol for that, or,
We
go
normally,
ahead.
yeah, it's not a normal process. I don't know if you know of an instance where something has happened like that, but normally we don't even steal from one department to give to another. If I need to find funds, I usually have some set aside that would be in an area that would be under the superintendent's control or my own. And
Okay.
the superintendent, of course, would deal with the superintendents, and mine, I take care of that. So I don't usually pull from one department to cover another department's expense.
Mr. Mendez, to further clarify, the form that is used to track transfers, the first signature, correct me if I'm mistaken, Ms. McCall, the first signature is at the primary stage or the primary location of those funds.
That's
So if
correct.
it is state comp, then the director who is charged with overseeing that budget is the first one that signs off. And then there are other signatures required. And as far as campus-based staff, there is a cutoff date that should be
There is.
shared with campus administrators, informing them as of this date, you no longer have access to those funds if it needs to come back. And then transfers may be made over at central office. But that process has allowed for the notice to be given as part of the movement of the money.
Thank you very much for that clarification. So with that information, is that information disseminated across the district? And are they aware of that, of those things?
We send out an
Well,
email.
they should, but
There was an email sent out, earlier in the year when we cut off the campus budgets. When we cut off for we'll be sending out an email probably this week or next week and letting the departments know, we're getting ready to close the fiscal year, and we're going to close out all our POs, and so you'll need to be out of the system. You cannot request any more items after this date, and we will get your budget to you, and we'll have another date sitting there. So that's our normal procedure, yes.
Okay, thank you.
Questioned item 1508A-7, request for approval of the Community and Schools Contract Agreement for the 2015-2016 school year.
I had a question on that, Madam Chairman.
Okay.
Was this item brought to finance meeting? I don't know if I missed it, or, I don't think it was it?
Actually, I don't think it was. We received the agreement in time to place it on the agenda for this meeting, because we do need to get it processed to be ready for the start of the school year.
I don't have a problem with it. I would like to have a presentation of some sort by the campus principals or the community and schools people.
In fact, I am scheduling a meeting. I asked this yesterday actually, for some information of how effective the program has been, and I will be bringing that information
That's
back.
my concern. It's a program that we've left alone. I don't feel it's being monitored.
Yeah.
So I know it's paid by state comp funds, but still.
What I was able to see today, there has been some positive effect. It's not, the program addresses attendance, academic performance, and there are three factors, three elements. And there was some noted improvement. It's not anything greatly significant, but there is improvement as a result of their efforts. I will bring that information, or send it in the Friday report. Send it out to all of you.
Because we're looking at over $200,000.
Yes.
He wants a presentation. Are you going to provide a presentation, Dr. Leo?
I can, and I can ask the officials
We-
from
we can go
communities
ahead.
and school to come in.
I make a
At the
motion.
next meeting.
I don't have a problem with the program. I just want to make sure it's monitored.
Further
and-
information.
yes.
Yes, sir.
With that being said, I'd like more, if it's 200,000.
Yeah, it's
I'd like-
26,000 per campus.
Per
And there-
campus?
Yes, and there's 6 campuses.
I'd like to table this.
You want to
item.
table?
Yes.
That's
Okay.
fine with me, too.
Okay, well, do I have a motion, since we're going to table this item, do I have a motion to table this item?
So move.
All those in favor say aye.
Aye.
All those against say nay. Motion passes. Item tabled. Question item 1508A-8, request for approval of the Region 1 Library Services and Instructional Resources Cooperative Commitment for the 2015-2016 school year.
Yes, what does the cooperative commitment encompass with Region 1 services?
I think we have
What are the services that they render for us?
There's several different things. Primarily, they do a lot of the digital resources, but they also have a lot of professional development and instruction as well.
Professional development, correct me if I'm wrong on this, but I'm under the impression, if we go with this commitment, there's a fee, correct?
Correct.
Okay. But at the same token, when we send people to Region 1, we pay a fee for those professional
We pay
developments.
discounted fees usually when
discounted.
we're members, yes.
Okay. So what other services do they provide other than the professional development and what is it? Yes, and what type of resources are we talking about?
Basically, we're talking about a lot of research, instructional resources, and teacher supplements as well.
Do we have a utilization of their services from last year? Could you share that?
I do. I have some of them. I don't have all of them because we have 2 new ones coming aboard.
Oh, okay.
Would you like to see them?
Yes, please, if you don't mind.
I apologize, I didn't make a copy for everybody, but. Yes, BrainPop is like a tutorial that a lot of all the schools use it, but primarily it's used at the elementary campuses. If we were to just purchase BrainPop as a district, it would be about the price that we're paying for the co-op fee. So we're getting a real bargain by participating in Region 1 co-op.
From your observation, if services are being utilized to the fullest extent and you have an impact on those services?
Yes, the librarians are usually trained once a year on all the databases or all the resources, and in turn, they go to the campuses. I myself do district-wide in-services on how to utilize them. Of course, when the students come into the libraries, librarians show them and teach them how to use the resources, as well as doing training on campuses for the teachers. And they are, all the links are embedded on all the library web pages, so the students have access. They're taught how to utilize them through the library web pages.
I noticed that the elementaries have very minimal usage on textbooks, which is
Yeah.
database. Is there any plans or strategies to improve that utilization?
Currently, we don't have a plan, but we just, we let the librarians know that they're there, and of course, they let the teachers know, and hopefully it gets passed on. We're trying very hard to teach the students to get away from Googling everything and to use authoritative sites, and this is one of them. EBSCO would be one of them.
And I asked this because as a parent, I do a lot of research, and I notice that you have these links on there, but I don't see any advertisement or information about the usage and how we could actually help the student on their research.
We do a lot of promotional, like bookmarks and posters, and of course, when they come into the library, we explain how to utilize them. That's one of the resources that we do when they come in. At the labs, we also give the information to the lab managers, and they encourage the usage as well.
Are these resources available for home usage for parents?
Yes,
All of them, or just?
Yes, all of
Okay,
them.
good.
How can we connect it to the parental involvement? Can y'all work on that?
I'd love to do that, yes.
Because I'm assuming that once the service is paid for, everybody has access to it, correct?
Mhm.
And
Every school has a unique username and password.
Mhm.
And we worked this past year at uniforming the username and password for each campus. So every database has the same one, and they just need one username and password to get into all of them.
All right.
Do you
Make
have,
it simpler.
do you have utilization information on those parents that use the software at home? Because I'm just trying to understand if it's being used at home, not less so, only because we're not doing a good job of promoting it.
We don't have that information, so
Okay, can we, I guess,
I don't know. I can look and see if they can find that for us, but I just don't have that.
because I think it could be a very powerful connection between the parental and the school, and if we're not utilizing a product that we're paying for, only in that aspect, of course, I think that we need to look more into it.
From the parent's perspective, if they're using these research databases, there's a lot of information that could be pulled out at no cost to them, whereas if they would go to a different provider, they'd have to pay $6 or $7 per item. So, I mean, I would like to see somehow a promotional kit or something that actually is...
Like a flyer or a poster or?
We've got KSBG, we've got those, I
Okay.
mean,
Okay,
please, if you don't mind.
Does, do you guys do, as a library entity, do any type of open house for a library where parents can come in and utilize technology that they do not have at home?
We don't currently, no, sir.
Okay.
We do have, at the high school, I'm at the high school, and we do have after-school hours.
Okay.
But not every campus
Right.
has that, sir.
Okay.
Just one quick question. I saw the utilization numbers and the values. Just quickly, how are the values generated? Is it generated by a child getting on and doing one search, a time frame? How do you
It
reach?
varies on the different databases, sir. Some of them, it's the number of hits that they get, and some of them, it's just when they log in and they do a search. It just depends on the database, how they send it to us, because each one is different.
The parents have access through students, right? Or do the parents actually have a username and password to go in there?
No, everyone has the same username and password.
Oh, so then, okay, so parents can actually go in there themselves and, okay, that's good.
Okay, thank you.
Question item 1508A-9, request for approval of delegate and alternate for the 2015 TASB Delegate Assembly.
I'd like to ask a question. Who had been our representative?
We usually would direct the newcomer, the new board member, to be the representative at the time. But
I'll make a motion, we have our newest member be the representative.
Will you be able to go? Because it'll be different times too, that you would have to go.
Yeah, the reason I ask is because I personally like that it be rotating and give all members an opportunity to be representatives.
Yeah.
The idea of it being the same one over and over any given time, let's share that. And you brought up a good point. If the new one gets an opportunity to be exposed. So in my case, I'd love to make a motion that Mr. Michael Vargas be exposed. As being the representative.
I second.
Alternate, do we have an alternate? Do I have a motion to approve item question 1508A, that the delegate be Mr. Vargas and the alternate Oscar Medrano.
You already had a motion.
Second?
Second.
Okay. All those in favor say aye.
Aye.
All those against say nay. Motion passes. We're going to go back and do I have a motion to approve the questioned items that are now consent items, which are 1508A-1, 1508A-2, 1508A-4,
So move.
what, wait a minute, I'm not done.
Keep going. Keep going.
Question item 1508A-8.
So move.
Second.
Okay. All those in favor say aye.
Aye.
All those against say nay. Motion passes. Okay, item number 8, closed meeting, discussion under the authority of the Texas Government Code 551.01 for the purpose of private consultation with the board's attorney on any subject or matters authorized by law. A, consideration and discussion of interim superintendent contract. 551.079 for the purpose of the appointment, employment, evaluation, reassignment, duties, discipline, or dismissal of a public officer or employee, to hear complaints or charges against a public officer or employee. A, report on personnel. B, employment, resignation, and retirement. C, discuss employment of Sullivan Elementary principal. D, consideration and discussion of interim superintendent contract. We convene into closed meeting at exactly 8:30. We reconvene into open meeting at 10:15 PM. Do I have a motion on actions items discussing closed session?
Madam President, members of the board, I would like to recommend that you approve the hiring of all employees discussed in executive session. Of particular interest to the community, the hiring of Crystal Leal as head softball coach.
So move.
Second.
All those in favor, say aye.
Aye.
All against, say nay. Motion passes.
And Madam Secretary, members of the board, I would like to recommend for your approval the naming of the Sullivan Elementary principal, that being Mrs. Stephanie Ramirez.
So move.
Second.
All those in favor, say aye.
Aye.
All those against, say nay. Motion passes. Item number 9.
Madam President, we need one more motion.
Okay.
The contract?
Madam President, I make a motion that we approve the contract with the interim superintendent.
I second.
All those in favor, say aye.
Aye.
All those against, say nay. Motion passes. Okay. Item number 9, meeting adjourned. Meeting adjourned.
Well said.